if I would try to describe what we do in our in the hospital, but in terms of ketamine assisted psychotherapy, this is my main practice in the hospital with asktamine. I also do ketamine, but in the hospital, actually, ketamine assisted psychotherapy or medication assisted psychotherapy is mine different. Is more of a transformation focused treatment and not material or drug focused treatment like we as psychiatrists usually think about treatment. If we think about psychotherapy as a mind part of the treatment, so the ketamine in this case, but it could be different materials are there or assisted the psychotherapy. We are trying to make a transformation or to move our patient from one point of suffering to a better point. And then ketamine could be, we can think about using ketamine in psychotherapy in various models. Dissociation, for example, is relevant for Dalek model, but it's not the only model of treatment. I will get time for questions because it's, I maybe just explain that actually you mentioned a lot dissociation, and this is regarded as like a side effect of the treatment from one hand, but and in the other hand, in researchers that try to check whether the dissociation, as you mentioned, related or not related. And so dissociation in psychotherapy is like it's vertical split. It's a protect mechanism. It's relevant in PTSD, but it's people use dissociation for ketamine because the kind of anesthesia it's make it's remind to them dissociation as a mechanism of protection, but it's not a good use of the term. So
I just think that's a good point, that the dissociative anesthesia is different from the term of disassociation as as you guys use as a defense mechanism. I think that's important to remember, that we're not inducing a defense mechanism with the use of ketamine. We're inducing a type of anesthesia which has the term dissociative because it's different from the usual kind of anesthesia.
Yes, and it's very relevant if we treat for PTSD, for example. It's very relevant for the psychotherapist to know and to recognize a very good dissociation that can, and really we do see it happening during ketamine sessions, but it's not what usually we use dissociation, to my opinion, in a wrong way in this term. Most people under ketamine feel very comfortable, feel good, feel and it's not dissociation necessarily in terms we usually use it as a defense mechanism and as something that we many times try to avoid. We can work through the dissociation as well, but many times it's not a comfortable situation. So